Okay, good afternoon, students and supervisors. Today I will be presenting our guest speaker from the Gastroenterology team at the Brigham and Women's Hospital, Glenmi DelRosario, sorry if I'm pronouncing your name wrong, was born in the Dominican Republic and has been at the Brigham for 15 years, initially as an aide in the Gastroenterology Section, and 3 years ago was promoted to Patient Care Assistant on the Intravenous Therapy team. So please welcome Glenmi DelRosario.
Hi, my name is Glenmi DelRosario. I'm from Dominican Republic. I speak Spanish and English. And I came to Brigham 2007 as a PCA in GI 15AB. And I worked there since like 3 years ago. I came to IV team. And I'm the assistant for PIC line.
Tell me what a PIC line is, so like what do it do, like a patient that needs
The PIC line is a
peripherally inserted central catheter.
Yeah, they usually use for the patient. They need chemotherapy, antibiotic, and TPN. Sometimes they use for short term and long term. And we do this is the same as a midline too. Midline is for short term, the antibiotic. It's only good for 29 days. That's it.
Okay, and then maybe talk about like what a typical day looks like when you are a PIC assistant.
The PCA first.
Yeah, talk about the PCA first. Yeah.
When I was working as 15AV and GI floor, is the typical day as a PCA is I have to go and take a report for the nurse. We usually work on the RN, and they give you whatever happened with the patient, if the patient has any Crohn's disease, if they have colon cancer, whatever happened with GI. And we took the vital signs in the morning. We have to walk the patient. We have to bed the patient. We have to do finger stick. And that's all I think we do. And as a PIC assistant, I have to check the patient, what antibiotic the patient takes, and what arm would we have to use. If the patient needs like a TPN, but I usually work on the RN or the PAs.
And then how many PICs do you assist with a day?
We usually do like 6 PICs of the day. And now we're doing like 12 hours, could be like 9 PICs.
So hi everyone, my name is Sasha Dubois, I'm the nurse director for the IV therapy team, and Glenmi actually is working today on the PIC service, and what she also does is, and she's holding back, but I will say that she helps patients get discharged and get home faster. So any patient that needs any of those antibiotic therapies, TPN, which is total parenteral nutrition, so some people can't eat, and then they need to have nutrition through their IV. So it goes right into their system. Glenmi helps with making sure that these patients get that access and that they don't get any infections. So she's being modest, but the job that she does is a big, big deal. If Glenmi's not here, things don't run. So, you know, being able to contribute to any kind of healthcare team and coming into this is so wonderful. And she also has a daughter that's going to go into nursing school. So she's really, you know, passing the buck forward.
That's the best thing, to be in medical career.
Yeah.
I enjoy whatever I do. I love. I was loving as a PCA, as a victim, I loved. You have to love whatever you do. You have to love. Yeah.
Does anybody have any other questions? Glenmi's just really a valuable asset to our team, but also the institution. Also, I'm going to brag on her a little bit more. So we have an entire float pool team of PCAs. So when she worked on the 15th floor in GI, we have a big team of PCAs, and they go all over the place in the hospital. And there's a small group of them that watch patients get lines either put into their neck, put into their arm, put into their chest. And that line, that IV line actually goes right above their heart, which it sounds very dangerous, but it's also for those long-term therapies, or if a patient can't get a regular IV. So she's trained all of those people to know what to look for in case the physician or whoever is placing the line may touch something, right? So we have something called sterile field. And when you do a sterile field is when you're going to be inserting things or doing invasive procedures. So if I put on gloves and a mask and they're sterile, I can't touch anything. Sometimes you say, oh, my face itches, you know? Well, it's kind of like if you put on like all of your snow gear, or you're going outside and you're like, great, I have to go to the bathroom. Like you have to start the whole process all over, right? So if you touch something with this sterile stuff, then this is what she does to them. She goes, mm-mm. And then they have to do everything all over again. And why is that important? That saves the patient from getting an infection, which could ultimately, worst case scenario, kill them, or actually make them be in the hospital for longer, and they can end up having ICU stays and get really, really, really sick from blood infections. So Glenmi is actually a driving force in the hospital and has saved many lives in advance to make sure that patients don't get bloodstream infections. And we also call that sepsis, or a catheter-associated bloodstream infection. She's being modest. Does anybody have any questions? She's happy to answer. She just really wanted to tell you guys, you know, what she does every day and how much she loves everything.
Well, I'm going to jump in for a second. This is great. I think we're getting a real technical kind of view. And I want to invite, I've gotten a question or two sent directly to me. But I want to invite students to, we have a list of questions, but before we go to those questions, if any students heard anything that they're not sure about based on what was just said, because there's a lot of technical information there, feel free to jump in right now and ask those questions, and we'll go to our list of questions in just a minute. So for example, one question that came up, I believe I heard you say that you're a PCA.
Yes.
Can you explain what that is for people who may not know?
Personal care assistant.
Some people use the term CNA or nurse's aide interchangeably. It's the same role, but it just depends on where you work and what department you work in.
Okay, great. Any other questions that students had based on what was just said in that introduction? All right, so we just had a question in the chat. I don't know if you guys caught it.
Oh yeah, so a PCA works under the discretion of a licensed clinician. So technically a nurse or a physician, but basically they work on the unit on the floor, and then they help take care of patients. So they deal with daily cares. They do vital signs, like she said. They do EKGs. In some places, they draw labs, like they draw blood for morning labs. Yep. So you learn phlebotomy. Mm-hmm. And it depends really on the department, but in general, it's more so making sure that the patients have an extra person besides the nurse to help with daily cares and making sure they're eating and things like that, because some people can't feed themselves, some people can't walk to the bathroom, things like that, and the PCA will help the nurse with making sure that the patient gets all of their needs met for the day. Now, Glenmi is a PCA now, but her role technically is a lead PCA because she's a PIC assistant and she's still working under a nurse, but it's different from what the floor is, and that's why she works on the PIC team, where she makes sure that patients are making sure that they're getting the right sterile field and they're not getting any infections when they get the catheters placed.
But as a PCA, we empty all the drains, like a JP, Yeah, and colostomy, Foley. Yeah.
So when patients have surgeries, sometimes they come with drains that are sticking out of maybe the side. Sometimes they have drains that help to empty their bladder, things like that. The PCAs also will drain those to make sure that they don't get blocked up, and then they record a lot of the data that they collect. So that way, when the nurse or the physician comes around, they'll say, okay, this patient is progressing nicely. They can go home or they can go to rehab. And so all that, those measurement things are very, very important.
Finger stick.
Finger sticks, checking patients. So if any patients that have diabetes, they also do finger sticks, and they make sure the patient's blood sugar is at a right level. They record that. They let the nurse know. If patients are having chest pain, they do EKGs, and it's a whole test where you put stickers on people's chests and you can capture what their heartbeat looks like. They do that. They do a lot of great tasks to help patients move along and making sure that we're not missing anything in their care.
As a PCA, we usually work under a nurse.
Mm-hmm.
I mean, when I was a PCA, I usually check my vital signs like temp, BP, oxygen, like everything. And then if I see like something like doesn't match, if the BP was high or low, I usually notify to the nurse.
Mm-hmm.
And it's the same with the finger stick and everything. We have to be, the nurses, they are really busy. We are with the patients we spend more time with the patients. So most of the time we know the patient more, like the nurse, you know what I'm saying? Because we spend more time. It's really, you have to put in yourself in there, like if it's your family who just treat like the right way. You have any question?
We have a lot of questions. We got a long list for you. I think we should start in on the list. So Aisha Muhammad again is going to be our facilitator for this. So Aisha, take it away.
Hello.
Hi.
Can you hear me?
Mm-hmm.
The first question is going to be asked by Neilani.
Good afternoon. My name is Neilani, and my question is, did you get any medical experience in Dominican Republic?
No.
You came here. How did you become a CNA? Did you have to take a class or
Oh my God, that was like, thank God you guys now have the knowledge, because I came from DR in 1997, and then I went to East Boston High School. There was probably no communication, and I went to Bunker Hill Community College for 2 years to be like a CNA, because I don't have no one to help me. Like, okay, you can be for 4 years RN, you know what I'm saying?
Yeah.
And then for 2 years, I went to Bunker Hill for CNA. Now you guys have all the knowledge and everything. You can be a doctor, nurse, whatever. Yeah.
But being a CNA or a PCA is a great step to becoming a licensed clinician. So when I was in nursing school, I actually was a medical secretary. And the only reason why I stayed a medical secretary and I didn't cross over to being a PCA just because I had great hours. But a lot of people that are in nursing school actually become a PCA or a CNA, so that way they can learn their skills in addition to the clinical that they have. So they usually work like 1 day a week, and then while they're in school.
The next question is going to be asked by Alessia.
Sorry, what did you say?
Alessia is going to ask the next question.
Okay, thank you. Hi, Alessia.
Hi. So I'm looking for the question. So did you go to college? If so, what college and what did you study?
I went to Bunker Hill Community College for CNA. I mean, it's a lot because they teach you how to read like everything, like things. I was like, oh, damn, why don't do that? Nursing.
Yeah.
Yeah.
So,
Buckingham Community College.
and then also, if you don't go to a community college, I think the Red Cross also has training programs, but the Bunker Hill program was really inclusive. And, you know, she was able to really have a hands-on program there.
This is gonna ask the next question.
Hi, good afternoon. My question is, when did you realize that this was the profession you wanted to work in?
When I did my the internship.
Where did you do your internship?
Here.
Yeah.
In 14.
So you went to Bunker Hill and then you
I went to Bunker Hill like I like, you know, but when you put in your hands on, when you come to work and do your internship, you say, I love this. That's the best thing. Yeah.
Does anybody have the next question? And also just to know, so Bunker Hill, that actually follows a traditional nursing format where you go and you learn your classes and then you have an internship and or like a clinical, and then you learn how to apply the skills that you learned in class. And it's otherwise known as, you know, you apply your didactic training or your class skills into the clinical setting.
I just have a question. How was working during COVID?
How was work during COVID?
Interesting. At the beginning, like everybody, we was new because we don't know what's going on and everything what we expect. But I mean, they help a lot here at everything like how a lot of classes, how to doffen and to put in everything, how to take it off and everything. I've been working since thanks to the Lord, I never been like COVID positive. But it's good. Yeah.
I have a question. How many hours do you work?
45, 50, but regular is 40 hours.
Full-time job is 40 hours. We do also do per diem. So that means you work 1 shift a week or 4 shifts a month. And usually 3 of them have to be off shift, like so evenings, nights, or weekends. And the shift is usually about 8 hours. You can also do 12 hours. And then some people work 20 hours, 24, 32, 36, and 40. But full-time, if you're full-time, it's 40 hours. Most part-time people usually are in school or have like family obligations, so they only work part-time.
Aileen is gonna ask the next question.
What is your recommendation for someone who's going to the same field as you?
What is your recommendation for someone that's going to the same field as you? Like, what would you tell them? Like, what advice would you give them?
I mean, right now you guys have a lot of support, you know, but for me and mine, you have to like, you know, to love. Because if you come to work like every day and you hate, I mean, to do is like, it's gonna be tough. Sometimes we have those kind of patients, like really nice patients. Sometimes, you know, they are really sick, they could be crampy. But do not take anything personal even for the patients because they are really sick. And just prepare yourself, just trying to be like, for you guys, you have to be sure if you really like to be as a nurse or whatever you're going to choose as a medical field. You know, it's going to be good to start for all of you to do like a CNA. As a CNA, you can see if you really like to be, because you learn a lot as a CNA or PCA. I mean, you see like everything.
Alessia's gonna ask the question.
Is there anything you wish to have done differently on your journey?
Yes. I could be like a nurse. You know, if you have someone to tell me what I have to do, I could be like a nurse.
I tell her it's not too late. She thinks I've given up on her. It's not too late. She just wishes she became a nurse sooner.
Yes.
Can I ask a follow-up question on that? What's the challenge, Glenmi, for you to become a nurse now?
Where's my challenge?
What's the challenge? What's preventing you from
I know what I'm my challenge.
You're clearly very talented in the field. I'm just curious.
Yes, I have 3 daughters. One, she's 21. She's almost finished. She's finished in May. In my 18, she's going for nursing school. And to go to a school, I mean, it's really expensive. It's gonna be really, really expensive. That's the challenge.
So you're helping her get through school.
Yes.
Until you can go back to school.
Yes. Mm-hmm.
Why is it important to perform the role that you do, and why?
Why is it important to perform the role that you do? Like, what makes your job so important? You prevent patients from getting infections.
I prevent the patients to be like some kind of infection. Like the eyes to be like everything has to be sterile.
She makes sure that patients don't get bloodstream infections, which can actually make people very sick. And actually cause them to either have a longer stay in the hospital or to be readmitted, or to, it could cause heart problems. It could actually cause death if it's not caught, fast enough. So say like you cut your finger and your parents will say, hey, you need to wash your hands and put a Band-Aid on it, and put some ointment on it so you don't get an infection. Because if you got an infection in your skin, and then it went into your bloodstream, that could actually cause you to have what we call sepsis, which is a systemic infection or a bloodstream infection. So when you get an accidental cut, that's one thing. What Glenmi's doing with the team is they're making an intentional open space that goes straight to someone's bloodstream. So the risk for infection is super high because they're purposefully doing that so that way the patient can benefit from some kind of other medical need. So what she's doing is making sure that the patient does not get a tissue infection, and most importantly, a bloodstream infection. So it's actually really important. Every patient that gets a bloodstream infection from a hospital, it can actually cost the hospital up to $40,000 or more, especially considering the fact that it was avoidable. The other thing is that if a person has insurance, like if you have a car, you have car insurance, you have health insurance. So usually when you come into the hospital, you give your insurance card. Your insurance pays for most or all of your health care. Now, if the hospital gets money back from the insurance company after they get, whatever procedures or care that they're done. Now, if the hospital causes the patient to get an infection, the insurance will not pay. So the hospital actually pays for the entire patient's visit, and that can be very costly and actually be very dangerous. As far as like making sure we're keeping beds and stuff available and making sure people have resources. So when you come to a hospital, any kind of care that you need is there. Well, that also that also is important because we want to make sure that we're providing the safest care to you so that we can have the resources to do whatever you need, if that makes sense. What are catheter-associated infections that can happen to the patient? What are some? So it's a certain incident. So if anybody's ever gotten an IV, I'm trying to think about what you could compare it to. Okay, so for instance, right, if you have pierced ears, right? Sorry, it's my teacher hat going off. If you have pierced ears, and basically they take the little gun and then they put a hole in your ear, right? So what Glenmi's team does is they don't take a little gun, but they take something that looks like a wand, and it has a little piercer on it. Like say if you get blood taken, and they inject that into the patient's arm, and then there's a needle that goes through that and places the IV. Now, if that thing is dirty, say if it falls on the floor or the person touches other things and they break the sterility, as we said before, that actually can cause the patient to have the catheter-associated bloodstream infection. That's just the fancy word for it, but it's basically an infection in your blood. And that's what's very dangerous to the patient and really just has negative outcomes or negative consequences for the patient. And that's what we're trying to avoid. So for the early college classes at Bunker Hill Community College, you have to be in, so that's for you guys. Have you ever felt like you wanted to switch your profession, or did you ever give up because it was too hard or demanding? You ever feel like you ever wanted to quit because it was too hard?
No.
So at the end of the day, the patient, you want to be here for the patients.
Yeah, I've never think like, okay, I'm going to.
Okay.
And another thing you can like, to be so close to the nurse, are you working? I mean, most of the time, take knowledge from them. You know, like if they tell you, okay, do this, and you say, okay, I will do that. Just show me how to do that. And you're gonna be so good. I mean, if they tell you, okay, this is that, I'm gonna change the ostomy. Just tell them, oh, do you think I can be there to see how you change the ostomy? And you check everything, like steps they usually do it. And you say, oh, okay, for the next one, it usually, I mean, it's gonna be, you know what I went to 15 today to put in like a line, and that was like a rapid response.
Mm-hmm.
And I miss that, to be like in rapid response, you know,
Yeah.
like those kind of stuff.
So a rapid response, so she misses the adrenaline because what she does is very procedural. So everything is like this. So if you put all your sneakers in a row at home and you like to keep all your clothes folded, this is the kind of work that you'd like to do because everything is like this. What she's talking about is a patient had an acute event, or basically like their blood pressure dropped, or they started not feeling well very fast. And what happens is everybody, all these doctors and nurses and team members and respiratory, everybody comes to the bedside to make sure that the patient ends up being safe. Now, she misses that part because that takes a bigger team, just because what she does is so methodical. So that's what a rapid response is. We talk very technical. We'll try not to talk so much shop, but you know, I'll try to explain stuff as we go along. What did you want to do before you had this job? Like, did you want to become anything else, or you knew you wanted to be?
To be here.
You knew what you wanted to be. It's a calling. So, you know, when you say, oh, you know, I'm going to take this job because it pays well, some days there's certain things that you can never get paid enough for. So this is really a calling to be in the healthcare industry, to take care of the best and the worst of society, and to take care of patients when they're at their worst. Some people walk in these doors and they may get some of the worst news of their lives, and they may have a hard time with it. And then Glenmi will come up and she'll say, hey, I'm here to place a pick. And that patient may be nasty, but you have to just say, you know what? They're hospitalized. I'm not. They're going through something. You have to understand that everybody's having a hard time. So it's really a calling because you're taking care of the world.
Yeah, put your love in there, like your mom, whatever you love, put them like right there in the bed. You know, don't think about money.
Yeah.
I mean, the money's good, but it's more like, imagine for you guys to be sick. And then if you call someone like a nurse and you put in the cool light because you need like to go to the bathroom or pay medication, whatever you need, or to be in bed more comfortable, or the cold I felt, whatever. And if I'm going there, it's like, yes, what do you want? It's like, come on, I'm sick and you talk to me like that. I mean, doesn't matter how many times you call, we're here like to help them to feel better. That's
How was your experience in GI, and did you choose to be in that section? And then after she left GI, she came to the IV team, so she did change her position. But did you choose GI, or did you just say, that's a nice floor to work on, I think I'll work there?
I apply in there.
Mm-hmm.
Yeah, I don't choose like, oh, let me go to GI. I just apply there. My experience was really good because I learned for gastro bypass, Crohn's disease, colon cancer. I mean, everything has to be with GI. Like, and my mom, she was colon cancer, and then because I was working there, I was so connected with the doctors, and I know how to. When my mom was that, I changed the ostomy, those kind of stuff. It's like, okay, I can do that, and I was like, because I learned. I usually, it's like to be like when you're in that position, like to be close to the nurse, like curious, like to be, oh, what are you gonna do? Okay, do you think I can see what you're doing? And you've been learning and learn like every day, like. In this, we never stop to learn.
Any other questions? Did we miss any, Mr. Banks? I don't think we did.
We have plenty more questions. We checked into the audience questions. We're not even halfway through our list. So, Aisha, you can maybe just return to the list. I'm not sure where we go.
What is the most difficult part of your job?
What's the most difficult part?
Because when I was as a PCA, when the patient, you are so connected with the patient and the patient dies, it's like really difficult, and then you have to clean the patients, like that.
They feel like family.
Yes, yeah. It's really difficult. This one is when we usually put a sign on the door and like do not enter when the team or the doctors, they go in, and it's like I usually say, it's a sign on the door, and most of the time they say, oh, I'm a doctor.
And it doesn't matter.
I mean,
she gets to kick doctors out of the room because she essentially is creating an OR in a room at a patient bedside, which is sterile. So if other people come in with their regular clothes and they don't have all the sterile stuff, then they're contaminating the space. So the hardest part for her is to control that environment, because sometimes people want to see their patients, they want to move on, but if they're there placing the pick, if they're there placing the pick, she's got to maintain that because it's going to prevent the infection, and then the patient's going to be able to go home faster and be with their families.
What do you think is most important to do before your shift starts?
What's the most important thing to do before your shift starts? How do you set your morning?
I'm so organized. I usually I work with probably 5 nurses. Yes, and I have to know what the nurses I work, because I have to have the size of gloves the nurses have, and then I usually print out the the patients. Most of the time it's like 10 patients, 20 patients, and I have to check most of the time the PAs, they send the email the day before, and I have to screen all the patients, to see if it's for TPN, antibiotic, chemotherapy, and I have to, if it's for TPN chemotherapy, is like dual pick I have to do, and then I have to organize my ultrasound machine and I'm going with my ultrasound machine, all Brighams, all the floor, whatever they page me, I usually go and with the nurse and I place the pick.
She walks around the entire hospital going to patients so that way they don't have to come to a center, so they can still be safe and comfortable in their bed. She walks probably over 5 miles a day because the hospital is really big. And if people, I know she said PA, which is a physician assistant, and it's a different kind of healthcare role, kind of looks like a doctor or a nurse practitioner. And we work with a certain set of those PAs, and they'll send an email and say, hey, Mr. Smith needs to get a pick tomorrow.
I usually have this.
We still do pagers. They're real. And so they'll send an email and say, hey, Mr. Smith is going to get a pick early in the morning at 7 a.m. And then they're going to go to the OR. So also what Glenmi's team is doing is great, because if you needed this central line, what used to happen before is you would come into the hospital the night before you had your operation, and then you would sit and wait for the team to come in, because this team does not run 24 hours a day. Now that they're starting earlier, you could spend an extra night at home, be with your family. You just have to come in by 6 o'clock, so that way you can get set up, go through your pre-op procedure, your questionnaires, and then they'll be ready to take you at 7. So that way you can go to the OR. So we're making sure you don't stay too long in the hospital. We're also making sure you don't come in too early than you need to, and you can spend more time with your family.
Julia's gonna ask the next question.
Did your salary increase due to the pandemic?
No.
They actually froze. So full disclosure, and you can look this up in the Boston Globe. So hospitals actually really took a big hit, and I'm not sure if you guys are looking up anything around the CARES Act, and you probably hear about stimulus checks and things like that. Well, the hospitals also got stimulus checks, but because we had stopped taking patients and stopped doing surgeries, the hospital actually kind of froze with their financials. So everybody's retirements froze, and then they actually had frozen everyone's salary, so that way we wouldn't have to let people go, because it hurt the entire economy. We're fine now because we started doing surgeries and stuff again, but for over the summer, everyone in the hospital, all the way up to the hospital president, was prepared to not get a raise, not get any bonuses, because it was more important to make sure that everybody was present versus just some. How do you know where each patient is? Like, how do nurses and doctors keep track of their patients that come in and out of the hospital? Epic.
It's at the meeting. Oh, Epic.
We have a hospital system. It's a computer system that tracks, that mirrors where the patients, like where the floors are. So say in your house, you may have a living room, a dining room, a kitchen, and maybe a den on the first floor. And then if you live in a house that has a second floor, then you have your bedrooms. So we have a system that maps out all the rooms in the house. And then we'll know that, patient Smith is in the living room, patient John is in the kitchen, and then we can put them wherever they are. So any computer you sign into, you can look at this tracking system. And we also have like symbols and do notes and stuff like that. So you can say, oh, John is going to be leaving the living room and going home, 3 days from now. And then, in real time, in real person, you'll have the whole team, doctors, nurses, PCs, everyone taking care of that patient. And then they get discharged home. And then there's a person that takes them out of the system. So they don't technically delete them, because it's kind of like when you sign in and you have like a Google profile or like Facebook or IG, and it remembers all of your information so you can sign in. They just put it on the back burner. So if you ever have to come back in for any care, they pull that your chart or your tile or your information back up, and then they make you inactive.
How was your scheduling after before and after COVID?
How was your scheduling before and after COVID?
Listen.
We kept it the same.
Listen.
Our team has a very predicted approach. So it's not like we stopped doing picks. Actually, they got busier. So we've extended some of our hours, but she still works Monday through Friday.
Okay, what do you like most about your job?
What do you love most about your job?
It's like to learn every day about medications, about the patients, because most of the time I know the patient before I'm going to meet the patients, like what the patient has, and yeah.
The lifelong learning. You're always learning, learn something new every day.
Mm-hmm.
Who has another?
Alex is gonna ask the next question.
Okay.
What does your daily routine consist of?
What is my what?
Daily routine consist of?
We do 6 picks every day. On Tuesday is a little bit longer because I work 12 hours on Tuesday. Could be like 8 or 9 picks. It depends how everything go. If everything goes smooth, it's like 9 picks. It depends how, because sometimes we go into the floor and the patient has to go to the IR or they have to do some kind of test, and then we cannot do the patient, and then we have to go to the next one. If we have another one, it depends.
So if the patient's not doing anything or doesn't have anything scheduled, it's great. But sometimes these patients are so sick that they need multiple tests. So they may say, oh, you need a PIC, you need an EKG, you need to go for this test, you need to go to the OR, all these things. But a lot of times, the PIC that Glenmi, the central line or the catheter that Glenmi is placing, a lot waits on that. So a lot of times the patient can't get a lot of other things until they get the PIC placed. But depending on how sick they are, they may end up going a different test that just happened to be scheduled. So sometimes she'll see a patient at 8, they may not be ready, or they may be at a test, and then she'll come back at like noon and make sure that they're ready and check back with the nurse. Because it takes about 45 minutes to an hour sometimes to place each pick.
Like we did one today, we went to both arms.
Yeah.
We spend there probably like an hour and a half, because sometimes you go and you see everything fine to the vein and everything, and then you say, okay, the wire and everything, or the line doesn't drop, and then if it doesn't drop, you have to go to the other arm to see. And sometimes it's like day and night. It's like poof, you go into the other one, it's like easy.
Sometimes patients have, everybody has the same general anatomy, or like everybody's organs and stuff are in the same place, but everybody has a little bit of variation. Just kind of like my hair is a little different from Glenmi's, things like that. So your vasculature or the way your veins are set up sometimes may be a little different. And sometimes if you're sick and you get a lot of IVs all the time, you can sometimes get some scars, or your veins just kind of don't want to cooperate. And that's why sometimes they may try one arm and it doesn't work, because sometimes it actually jams, and then they have to go to the other arm to make sure that they can get the access. So it really just depends on each patient, but that's why they allow about 45 minutes for each patient.
Did you always dream of being a nurse?
What was the question?
Did you ever dream of becoming a nurse?
Do you ever dream of becoming a nurse? You want to be a nurse?
Oh, yes.
That's why I said she's not done yet.
Yes.
But she wants to make sure her girls are straight first.
What obstacles did you face in pursuing your career?
Can you repeat that?
What obstacles did you face in pursuing your career?
Wow.
In your career? Like have you faced any like opposition or hard things or
Right.
anything hard? Like, was it difficult to become a CNA? Was it difficult to become was it hard to become a PIC assistant? Like anything you had to fight against, or everything just?
No, as a PCA, I went for my class and everything. As a PIC assistant, I never. That's why you have to be good, whatever you do.
Yeah.
Don't do because your boss is around, or just to be. I mean, to please your boss. No, I'm sorry, but no, you have you have to be good. I never. I mean, when I was a PCA, fine. No, I don't have any, but for this position I have, I never applied and I never was looking for. Chris, she was a nurse, and one time she said, "Do you think you can come and work with us?" I was like, "Chris, please, doing what?" She was like, "Come." And she was like, that was Rick at that time. And she said, "Send the email to Rick." And I was like, "Okay, that's fine." My interview probably that was like 2 minutes. And but I asked Chris, I was like, how do you choose me? How do you know I'm gonna be good in that position? And she was like, because I see who work and who doesn't, and I don't even pay attention if someone is looking at me what I'm doing, or because, oh, my boss is there, let me do, or whatever I have to do. You have to know your goal, your responsibility. As soon as you start your job, they tell you what you have to do, but if you do like extra mileage, doesn't going to hurt no one. And that's it.
So that's great advice for any career. Definitely.
Okay, I know we still have a couple questions, but I just want to pause because we are getting close to the end. And Carlene, if you wouldn't mind jumping on.
Thank you so much for taking the time out of your day and come here on Zoom to teach us. We appreciate you a lot.
You're very welcome.
Yeah, sincere thank you from all of us. And I imagine you have to go at 2, but I know we also have a few more questions. So whenever you need to go, I'm gonna put it on you guys to say, okay, we need to end, but I know there's at least one more question.
Do you have a pick now?
She's with Wilfredo right now, but they're gonna do like a TPN.
So I'm gonna text her and just tell her, let us know when she's done with her pick. So we can stay a few minutes because the nurse that she's working with today is in a procedure now, placing a pick. So when she finishes, she will have to go, but she can stay for a few more minutes to do to answer some more questions.
I'm here.
So I think there was one more question. The folks who had the question, why don't you guys go ahead and ask?
Maybe not.
Does anybody have one last question?
Yes. What is the most difficult part working during COVID-19 after it came along?
What was the one?
What's the most difficult part of working during COVID?
To see all those patients like by themselves, like
Being in isolation.
yes, like they don't have just no one, like only us, like to go, because we usually go in and out. Whatever we need, we're gonna do it, and then we have to step out. Like that's the worst thing.
So before COVID, you could sit and you can talk to the patient, the families could come visit, but because it's so contagious and people sometimes don't know that they have it, they could give the COVID to staff members or they can give it to their family member. And because the healthcare workers are working with these patients so closely, like brushing hair, like we're close, that puts them at higher risk. So we can't do visitors unless like a patient is at the end of their life or unless they're being born, because it's really, really dangerous the way how infectious COVID-19 is. And that's why like we tell people, you know, wear your mask. Everyone in the hospital has to wear a mask. And actually the infection rate in the hospital is lower than in the community because every single person here is required to wear a mask. So the science is real. When people don't wear it or you have a lot of family gatherings, a lot of times what we see is entire families having COVID and multiple people being hospitalized. So it's one thing if you have pre-COVID, you had, you know, an aunt and uncle or somebody, you know, hospitalized, and you can go see them at the same time, but now no one can see them and now no one can be in the same room. So it's really, really, really difficult because you know the patients are lonely and humans are not meant to be alone. And pregnant women, sometimes they don't stay in the hospital. They have their baby and they leave in like a day. And then they have to set up extra support to make sure that they're safe at home. When usually pregnant women that give birth to babies stay maybe like 1 day. They stay like up to 3 days. But there's some women that are high risk and like they're that are at risk for having the baby too early because of medical complications. So there is a floor of women that stay here and they have to get admitted early. But then they still can't have a visitor because it's COVID. Even if they don't have COVID, it doesn't matter because sometimes you come in and you don't know that you have it. And you may test, and we test every patient that comes in. But sometimes if that takes a day, we still test people multiple times because it takes about 5 to 7 days for the virus to show up on tests and really in your body. So it's kind of like, you know, if you have a cold on Monday, you may have already picked up the germs from the cold on Sunday or Saturday, but you may not start having cold symptoms till Monday. And that's what happens. And that's why it spreads so fast. And that's why we can't have visitors. But it's really, really hard to see people alone.
Are you guys required to take the vaccine or is it an option? The COVID vaccine?
It's an option.
It's an option. I did mine.
Yeah, I did mine too. I think down the line, it may be mandatory, like the flu vaccine here is mandatory because what we often see is for the flu vaccine, people can infect all of their coworkers for like 3 days before they start showing symptoms. So Glenmi could work Monday through Wednesday and she can get the whole team sick with the flu because she worked for 3 days because she didn't have any symptoms. And then by Thursday, she's like, oh my goodness, I don't feel good, I'm going home. And then she has the flu. That's dangerous. And that's why we really try to make sure that, you know, we stay vaccinated and we're washing our hands and doing proper hand hygiene and making sure we're social distancing.
For you teenagers, if you go into some places and you see someone that don't wear a mask, don't be silly, wear yours. You know what I'm saying? Like, doesn't matter if they don't do that, just take care of yourself because it's really hard if we have to be as a patient and be ourselves here.
Yeah, and you might see people on Snap, you might see people on IG out there having fun, they might be doing all kinds of stuff. Don't do what they do. It's not safe. And sometimes people have COVID and they don't even know that they're spreading it. And also because this is such a new disease, you don't know what it's going to do to you in 10, 15, 20 years from now. And they say that it actually is not, it takes, you know, years off of a person's life, but we still don't know that yet. But people have a hard time after COVID. They're tired all the time. Sometimes people can't breathe right. They can't exercise. Sometimes people can't even work. Some people have strokes. It's very dangerous. So just make sure you're taking care of yourself. And if people say, oh, come to this party, or even if it's family, come to, you know, it's somebody's birthday. Now is the time where if people make you feel bad for trying to attend an event, then they have the wrong idea. It's okay to say no. It's okay to say no, because that might save your life.
I would like to thank you guys for having this meeting with us. I appreciate the fact that you guys took your time out of your day to actually talk with us. I hope you guys have a great day. Thank you so much.
Thank you.
Thank you.
Good luck in school and be safe out there.